When people talk about doctors fearing AI, the discussion usually turns to the idea that AI will replace doctors. That situation doesn't really worry me. I'm responsible for my patient. Responsibility in medicine has not moved. My concern is something more. My concern is something else. It is the nuisance that AI causes inside the consultation. The consultation begins before the patient walks into the room. Patients increasingly arrive having already spoken to an AI system about their problems. The answer appears neat and confident. It looks researched and authoritative. By the time the patient sits down, the consultation is already pregnant and pre anchored. Sometimes it enters a pre conclusion. I think it might be autoimmune, or the AI suggested this, or it could be cancer, it said. The consultation has already happened without the doctor. This is my fear. It is what I fear will change the nature of my work. It is the undoing of the anchor and winding the tight explanation that has already formed in the patient's mind. The patient already believes that they understand the disease. They already expect a particular test or treatment. What follows is often resistance and re education that I have to navigate. Not because the patients are uninformed, but because they are. The AI answers are certain, and certainty is persuasive. Now I have to be equally as certain and confident to reassert my authority as the real doctor, the one that has to carry the responsibility. Real medicine rarely breathes with this kind of certainty. Doctors think in probabilities. We gather information, examine the patients, look at the patterns that's there, and adjust our judgment as new information appears. We adjust and tailor our questions to the patients, questioning to the patient in front of us. A rambling patient, a quiet one, a reserved one, a confident one, or an unsure one, a nervous one, or a blase one. A disease description is not a diagnosis. A list of treatments is not a treatment plan. But when a patient arrives with preconception and prejudgment of understanding of disease conditions, the first part of the consultation often becomes explaining. Explaining why the situation is more nuanced than the AI spelled out. That takes time, patience, and sometimes several steps of clarification. Another part of this dynamic appears in expectations. Patients arrive expecting a particular scan, a particular blood test, or a particular medication. When the clinical assessment does not support those options, the consultation turns to explaining why the test is unnecessary and why the treatment is not appropriate for that patient in this situation. So the consultation sometimes begins with anxiety that was generated earlier, before we even start examining the problem. Part of the work is calming the story that has already formed elsewhere. It is the result of AI answers appearing before clinical consultation proper. Doctors have always corrected misunderstandings. Google searches created similar situations years ago, but AI answers are different. They sound more coherent, confident, complete, and intelligent. And confidence is powerful. But confidence is not the same thing as judgment. Clinical judgment depends on context, the patient's history, examination, and previous illnesses and patterns that develop over time. AI systems do not see those things, doctors do. What AI has really done is shift the starting position of the consultation. The doctor and the patient are no longer always beginning from the same place. Instead, the conversation may begin with a narrative that has already been written. This is the new work doctors have to do: more conversational work and more emotional and psychological navigation in untangling, resetting expectations, and reconstructing understanding. AI will become part of medicine. Technology always does. But the consultation itself, the conversation between the doctor and the patient, remains where real judgment happens. And increasingly, the first step of that conversation is gently unwinding and rewinding the story that began somewhere else.